Bismillahirrahmanirrahim. My name is Abdul Ahad and I am the final year DVM student at University of Veterinary and Animal Sciences, Lahore. Today I am here to present a very interesting and rare reproductive case in dogs. And the title of the case is Placental chorioadenoma in primiparous pug dog. So this is a published case study. Towards our case, as we know that dogs have zonary inferior chorial placenta. Although placental pathology is common in all other livestock animals, only a few prolific placental lesions have been described earlier, just such as trophoblastic hyperplasia or hematomas. No confirmed placental chorioadenoma has been previously reported in living dogs. So this case is a very valuable case and provide valuable insights. So if we talk about the case description of the animal that was presented at the authors, the patient was a 2-year-old primiparous pug. History showed accidental mating with a male pug approximately 48 days before presentation. The bitch appeared healthy and pregnancy progressed normally up to late gestation. Ultrasonography was also performed, and if we talk about the ultrasonography findings, so we found that normal fetal heart rates, developing kidneys and gastrointestinal tract, and biparietal diameter suggested parturition within 4.2 minus 2 days on the first scan, and second it was again scanned and it suggested that 2.6 plus minus 2 days on the second scan. So no abnormalities were detecting in the fetuses or the placenta at that time. And then we have signs of labor and C-section as the due date approached. So the bitch showed classic pre-whelping symptoms that were include reduced appetite, nesting behavior, and drop in body temperature. Fetal heart rate remained normal. However, the owner elected for C-section. It was owner choice to perform C-section. So during the surgery, 6 puppies were delivered. 5 were vigorous and 1 was weak. So 5 were healthy and only 1 was weak, small, and severely distressed despite oxygen therapy, and it was eventually euthanized. During the surgery, all placentas were collected and inspected also. 5 were okay, and the one placenta displayed a distinct mass. Unfortunately, placentas were not matched to individual puppies, so it is unknown whether this normal placenta belongs to the weak pup. So if we talk about the gross findings of the placenta, the placental lesion was measured. It was 1.7 into 1.2 into 1 centimeter. These are the dimensions of the lesion. So if you talk about the appearance of the lesions, they were smooth pink to flesh colored, well circumscribed, and they were located near the marginal hematoma. The tumor protruded outward on both maternal and fetal sides, suggesting involvement of the chorioallantoic placenta. I have described earlier about placental examination. Our placentas were collected, and one placenta had abnormal mass, but we are not able to match the placentas to the puppies, so it was unknown which puppy was affected with the affected placenta. Histopathologic examination was also done there, and histopathology says that a non-encapsulated exophytic proliferation arising from the stroma of the chorioallantois and forming a arborizing fronts over the labyrinth. Cells were cuboidal to columnar. Trophoblastic cells showed moderate pleomorphism and evidence of 14 mitosis per 10 high power fields, and it was frequent cellular atypia, including megalocytosis, multinucleation, syncytia formation. And importantly, the lesions did not invade surrounding tissue, and the pictures of the pathology slides are also mentioned there. So based on the histologic features, the mass was diagnosed as a placental chorioadenoma. Uh, that we also can say a benign trophoblastic neoplasm. This is the first confirmed report of this lesion in a canine pregnancy. So in this way, we can say it is a very valuable case study. The case here we have highlights several important points. Placental tumors in dogs are extremely rare, so which may lead to under recognition. Secondly, some proliferative trophoblastic lesions described previously are non-neoplastic, such as hyperplasia or hematomas, but this case clearly met neoplastic criteria. And even though the tumor was benign, it may have interfered with placental function by compressing vessels, reducing nutrient or oxygen transfer, potentially contributing to poor neonatal outcome, such as such as low birth weight or neonatal death. Most importantly, the clinical significance of this case. So the key clinical takeaway is placenta should be routinely inspected, especially during C-section or dystocia cases. Although rare, placental tumors can compromise fetal development and may explain unexpected neonatal mortality or growth retardation. Finally, concluding the case, this is the first documented canine case of placental chorioadenoma. The lesion was benign in this case study. The lesions was benign, but may have contributed to the poor condition of one neonate. So through placental examination, we can improve the understanding of perinatal outcomes, and guide future reproductive management. So it was all about my today's presentation. Hopefully it was helpful for you. Thank you so much.